Welcome to Billington Federal Cyberbytes, and I'm Tom Billington. It's my honor to introduce to you Bruce Brody, the Senior Chief Information Security Advisor at Cisco, who will interview today Gerald Caron, the CIO for the Office of Inspector General at HHS. It's my honor now to introduce to you Bruce Brody. Bruce?
Greetings and welcome. I'm Bruce Brody. I'm a Senior Chief Information Security Officer Advisor at Cisco Systems, and with me today is an old friend, Gerald Caron, who's the CIO of the Health and Human Services Office of Inspector General. Good to see you again.
Good to see you
How
too,
are you
Bruce.
doing?
Great to be here. Oh, good, thank you.
We're going to talk about Zero Trust today. Is that a topic you've heard about?
I've read a little bit about it.
Okay. So there have been a host of new strategic policy initiatives and action plans launched by the Biden administration. How are you looking at the multiple actions, and how are you prioritizing them within your own organization and with the HHS OIG cyber workforce?
Yeah, no, thanks for that question. Yeah, Zero Trust is very important. Like I said, I have read a little bit about it. I think it's very important in regards to it's the way we should be doing cyber and concentrating on what we protect. And to me, you know, the ultimate thing that we're trying to do is protect data. That is, you know, the thing that is the lifeblood of what we do with IT. A lot of people would argue with me on that, but, you know, I always say, you know, or somebody will say, well, it's about identity. And identity is very important, but I will tell them, if you're a cybersecurity analyst and you're inspecting my account that got compromised, you're going to ask, what did I have access to, and is there data exfil? So what is that about? That's about data. So I think the executive order the Biden administration has done is great. It prioritizes cybersecurity. It says, and the key word in that is strengthen. And strengthen means being more effective, not just compliant about cybersecurity. So that effectiveness is very important in how we measure that. How I go about prioritizing it is I have taken and created a Zero Trust capabilities, functional capabilities model. DHS has broken it down into 5 pillars. I actually break it down a little further into 7 or 8, and then I have functional capabilities within that. And with those functional capabilities, I've done an inventory of what capabilities and solutions do I have. I'm government, so I work on a 2-year budget cycle. I have no income coming in other than the budget that I get. So what can I do with the investment that I have today without spending another penny? And then I take DHS's maturity model against those capabilities, and I rate myself. Then I know where most of my work needs to be done, where I'm doing well, and where I have gaps. And then those gaps I can start exploring, you know, through market research with vendors that can fit those gaps. I've also, in addition to doing that, then I also have 5 what I call foundational projects. One is around maturing our identity management. One is doing data mapping, and that's different than network mapping, but actual data mapping. Doing integration, because when I get to Zero Trust and I do what I call dynamic confidence score, or dynamic risk score as I usually call it, but confidence scoring is what they're talking about now, kind of changing the terminology. I need to integrate and take in a lot of factors to make decisions in a dynamic fashion. And doing discovery. What are the things that I own? So I know what the things that I am under my control or my realm of control. And then those are the things, you know, those may have some less risk because I can do certain things with those. And then drawing out our roadmap. So we're drawing out our roadmaps per the pillars, the 5 pillars that DHS has. So we have an objective, like objective 1 with pillar 1, let's say, and what are all the projects that need to get to that objective. And we're looking at all pillars at the same time, because I don't think you can just do one pillar at a time, because you'll probably end up going back to re-engineer, because you have to also make sure everything integrates and works at the end of the day.
So thank you for that. That tells me where you are on your Zero Trust journey. I'd also like to know if you have any comments on some of the foundational elements of putting policies in place and dealing with data governance and putting some workforce people in place, and some other adjustments to acquisition and gathering funding. Anything like that you want to share?
Sure. As far as data, first and foremost, if that's what we're trying to protect, I need to know where it is, what it is, where is it going. So that's why we're doing data mapping, understanding. We're going to take one application initially as a proof of concept and trace what is the data and where is it got hooks into, where is it flowing, where is it going. We're also drafting in, as far as people, we're drafting in the users very early into our journey as part of the team. I like to describe the team, the people on the field that are getting the things done, are actually going to do the implementation of Zero Trust. Then you got on the sidelines, you got your project managers, your program managers, all those things that are helping support the team on the field. Then, of course, you got the people in the C-suite, providing the budget, the prioritization, making sure that your team is successful on the field. And then why are you doing this? You don't have a team unless you have fans. And that's what you do it for. And who are your fans? Their fans are your user base. So why is the user base important? Well, of course, you want to include their requirements. So you want to know how they want to work. I say how they want to work, not how they work, because sometimes they're working because that's the way things are. But really, how do they want to work? So we can build those requirements in. And also gain information. What is it they're accessing? Where data is important to them? Where is that data? So we can start getting that map and make sure that we have an accountability for all that data, and make sure it's categorized properly and all of those things. So users are very important. Plus, we tell them about the benefits as well. As far as the workforce, when I came in, kind of introduced Zero Trust concepts to the workforce. They have since grasped onto this, done a lot of training. We're doing some proof of concepts with certain capabilities. They're learning a lot and getting involved and coming up to speed. We talk with a lot of vendors to get an idea of what the art of the possible is, so we know where things are going as well. So there's a lot going on as far as policy. Policy's going to be kind of, it's hard to say I'm going to develop this policy now. It's going to be kind of let's see how things go, what really needs to change, and then we'll do the policy in conjunction with that. Because this is an architecture, and one of the most important things when you have an architecture is having that governance, and so that those governance changes will affect what the policy is. However, when it comes to data, it's going to be very important. Once we get this established, if you want to work in this network that we own, for lack of a better term, network or environment is probably a better term to utilize. This is how you fit in if you want to. So it would be very predictable because it will be no more baling wire and duct tape of, if you're trying to shove a new system in. This is all the requirements that you will have to be into this environment from there on forward. So that policy will be affected as we mature going forward.
I like the baling wire and duct tape. I think that's a very important set of tools.
I was a big MacGyver fan.
So I know you came over to HHS from the Department of State. Fundamentally, the Department of State had different data to protect. It was more around international diplomacy. And at HHS, it's more about healthcare. Can you give us an appreciation for the different kinds of data that you're concerned about, and what protection mechanisms you could put in place?
Yeah, so by nature of the mission of HHS OIG, of course, we do fraud, Medicaid, Medicare fraud prevention. We have auditing, which does cybersecurity auditing, as you can imagine. We have our Office of Investigations, which does investigations of fraud, organized crime, opioid abuse, things like that. We have litigators as well, that do a lot. So, there's law enforcement sensitive things, audits, as you do audits, the vulnerabilities of what you're assessing or auditing. So, that's some sensitive information. If it got out in the public, could be embarrassing to the federal government in some form or fashion. So we want to make sure that we properly protect that. So it's going to be very important to understand where that data is, what that data is, who needs access to it, And that's one of the things about bringing the users early in as well, is we want to make sure, how do they want to access it? When do they need to access it? So we get the right data, the right people at the right time. That's the important identity aspect of it. But it's the right data, the right people at the right time. It's not all the time to all the people. It's very judicious. So that's kind of what's going to, govern that. So that's why I think it's very important to bring your user base in early to understand their needs. Because at the end of the day, HHS-OIG was not put on this earth to do IT security. It was actually to do all the other things that I talked about: fraud, waste, and abuse, Medicaid, Medicare fraud, those things. IT is an enabler. So we're there to do it for our fans, which are also our users. So that's who we want to make happy and make sure that we enable their mission, but do so securely. And they have data that when they access it and make decisions and report on it, that has the integrity that they would expect. Going back to this, the availability, integrity, and confidentiality model.
So thanks for that perspective. That was very, very helpful. What can you tell us about the federal government Zero Trust Working Group, and how is it being used to improve Zero Trust across the federal civilian agencies?
Yeah, so the Federal Zero Trust Working Group, the CIO's Innovation Council, I co-chair that with Gerald Caron, who is actually running the project at the NCCOE. He's doing a Zero Trust project there, as well as Sylvia Burns, who's the CIO at FDIC. And it's a great group. It's made up of some great people, a lot of good thinking. That's actually where NIST, of course, has 800-207. It actually started with this working group, and that's kind of why I joined a little later on. And it's doing a lot of discussion. We're doing a lot of data sharing, or best practice knowledge now. We've had some people come in from different agencies, share playbook ideas, share, like we just had some contractors from one agency take an application and all the services and all the 853 controls, and it passed with flying colors through an ATO, but when you put Zero Trust against it, there's a lot of work to do with that application. So it's not going to be a one-for-one, where it's going to be, well, being from an IG, it's going to be difficult for auditors to actually audit, take 853 against a Zero Trust environment. So how things are assessed and audited, how we measure effectiveness is going to be very important. So there's a lot of those types of discussions going on. We're actually talking about, like I said, best practices a lot right now, bringing in great ideas. We're also keeping in touch with what the other working groups are doing, the nonprofits. I also chair at one of those as well, and we're doing demos every Friday. We got about 54 vendors doing demos based on requirements and use cases that we provided them. I've talked with other working groups as well. There's a lot of good working groups out there with a lot of good ideas. And so I've been kind of seating in all of those different working groups and learning. And I'm always learning too. I talk a lot about it. I brief a lot about it. Try to educate people about it. But I'm still learning too. And there's a lot of great ideas out there. I've actually briefed the IG community on Zero Trust, and they're like, yeah, this is going to change how we do our job. So there's understanding of all the different tribes of people out there that are going to be affected by this. It's not just the IT people. It's going to be the users. It's going to be the auditors. It's going to be the assessors. It's going to be the data owners. It's going to be the system owners. So you got to think about, when you do that playbook, how all these people are affected and what it means to them. So one of the other things we're doing as a sub to the CIO's Innovation Council is GSA started developing what they call a playbook as well for agencies. We have the EO, which is we need to do this. We have 800-207, it explains what Zero Trust is. You have the OMB memo, 22-09, says you need to do these things. The playbook that GSA is working on, which I think is a great thing, is here's how. So I think that kind of brings it all together at the end of the day. And I know DHS is releasing a lot of great materials as well. So I'd be on the lookout for that. They just released, for public comment, one around mobile as we speak today.
That's a lot of great activity, and I'm glad to see that the federal government is progressing along the path to to zero trust. That would be an excellent end state to achieve, although the journey is very long and very hard. Gerald Caron, CIO of the HHS Office of Inspector General, thank you very much for joining us today, and thank you for your comments.
Thank you, Bruce. Great pleasure being here.